Cervical cancer is the second most common cancer in women. So, who can get a cervical cancer? Any woman who is sexually active can get a cervical cancer. It's a myth that the women who are very clean, who are high socioeconomic status do not get cervical cancer. Any woman who is sexually active can get cervical cancer. So, how to know if we have a cervical cancer? The cervical cancer unfortunately doesn't give many symptoms, but some of the few are abnormal vaginal discharge, foul smelling discharge, abnormal bleeding, postcoital bleeding. So bleeding after intercourse is one of the characteristic symptoms of cervical cancer. So how do we get a cervical cancer? Cervical cancer comes through a virus called as HPV virus. So once a sexual activity starts in a girl, the virus enters our body and our body immunity tries to push the virus away. For some whose immunity is weak, especially those who have other comorbidities, those whose immunity is less, cannot push the virus away. The virus grows in their body and gives rise to this cancer. So what are the risk factors for getting the cervical cancer? As I already told you, women whose immunity is less, like already having HIV, taking a lot of alcohol, tobacco, lot of sexual partners, promiscuity, and very young age at starting sexual intercourse. These are the risk factors for getting a cervical cancer. What tests can be done to know cervical cancer? We can do a simple test called as pap smear or a cervical biopsy to check for cervical cancer. And how to prevent the cervical cancer? Yes, this is a disease which can be prevented. One is getting vaccinated. So adolescent girls who are 9 to 11 years and 9 to 13 years and boys should be vaccinated against HPV virus. We have vaccines now against the HPV virus, which is recommended for adolescent girls and boys. And screening with the pap smear once every 3 years till the woman is up to the age of 65 years is a very important step in preventing cervical cancer. But after doing all these, if the women get cervical cancer, how do we treat it? So it depends on the stage of the cancer. So if the stage is still in stage 1 or 2A, we can do a surgery. So a big removing of the uterus, cervix and the associated tissues, affected tissues and lymph nodes will cure from the cervical cancer. But if the stage has gone up to 3 and above, then radiotherapy is a treatment of choice.